we are going to have a discussion on a really important topic. Before we begin, I want to give our audience a general insight into BabyChakra, what our platform is like. BabyChakra is India's largest pregnancy and parenting platform. It is a one-stop destination for parents, pregnant women, and expecting parents. We try to connect parents with experts who bring valuable information and research-based information to all. And on that note, I would like to kickstart our topic for today. We are going to have an informative discussion today on is normal delivery. How can you have a normal delivery? And we have an amazing lineup of guest speakers on board with us. Please welcome Dr. Aishwarya Gwara and Dr. Nirmal Nitin Gujarati.
Hello.
As our guest for today. Thanks for joining. Let me introduce our audience to a topic once again. To the topic once again, we are going to discuss what normal delivery is. How can you have a normal delivery? A lot of women are eager to have a normal delivery, as they feel that natural childbirth with minimal interventions is the best thing. Discussing with the doctor, the birth plan is right kind of input and to frame the right kind of working.
Bonita, actually, I was not able to hear it completely. Like there's a conversation. Can you just repeat?
You're not able to
Question,
hear
please?
me? Are you able to hear me now? Dr. Aishwarya?
Yeah, tell me. I can hear you now.
Are you able to hear me now?
Yeah, I can hear you, Bonita.
So today we have with us Dr. Aishwarya Gwara and Dr. Nirmal Nitin Guti. Dr. Aishwarya, would you please introduce yourself? Can you hear me, Dr. Aishwarya? Hello.
Sorry?
Can you hear me, Dr. Aishwarya?
No. There's no disturbance in the voice.
Dr. Aishwarya, would you like to introduce yourself?
Okay, myself, Dr. Aishwarya B. I'm a gynecologist and obstetrician residing in a multi-speciality hospital, Bharat Kempanna Multi-Speciality Hospital, as a leading obstetrician here. It is very nice to be at your session today. Thanks to BabyChakra for giving me this opportunity, and to Bonita for hosting this. And I would also welcome Dr. Nirmal sir also.
Thank you, madam.
Dr. Nirmal Gujarati sir, would you please introduce yourself?
Yeah, I'm Dr. Nirmal Gujarati. I practice in Mumbai at Juhu. I work with Surya Hospital, which is more for high-risk pregnancy and preterm deliveries we do. And we have IVF center also here. And I go to the couple of more corporate hospitals around. Since last 12 years, I am practicing the obstetrics and gynecology. Thank you, BabyChakra, and thank you, madam. I guess we will have a very good discussion today about the normal deliveries and the new aspects about them.
Yeah.
So let us discuss the best way to indulge in the conversation with our experts in the panel today. So today we'll address the topic in depth. So shall we begin? So shall we begin, Dr. Aishwarya, Dr. Nirmal?
Yes, we both are there. Please.
Can you hear me?
Yes. Yeah.
Shall we start the question? We have a few questions here. So, Dr. Aishwarya?
I'm
Am I
audible. I
audible?
can hear you, Bonita. Please continue.
Actually, I'm not seeing you. I can't see anyone actually. That's why that's the problem actually. I can't see anyone.
Bonita, please go ahead and start questions.
Okay,
Madam will
sure,
start,
sure, sure, sure,
then we'll
sure,
answer. We'll
sure.
keep answering all the questions. Don't worry, we are there.
Okay, sure. Okay, okay. So, Dr. Aishwarya, what is the right time for a normal
Yeah.
delivery? Can you hear me? What
Firstly,
is
I would
the
just like to
right
give a
time for a
brief
normal
about what
delivery?
normal delivery is exactly. Okay. Before, yeah, normal delivery is a natural through which woman will be delivering her baby through her birth canal, that is through her vagina. This is called normal delivery. More than calling it as a normal delivery, vaginal birth. Okay. And the ideal time for a woman to go into labor or to have a normal delivery is when she completes her 37 weeks counted weeks. That is because the baby maturity will be 100%, lung maturity will be 100% only after 37. Before that, if she's going to deliver, it is called or preterm delivery. So ideal time is between 30 weeks, 40 completed weeks. That is 1 week delayed by her delivery. That is, we calculate her expected date of delivery from her last menstrual period. If not, from her first trimester scans. So anytime after 37 weeks, the ideal time for her to deliver vaginally. Anytime between 37 weeks to 40 weeks.
Okay, thank you, Dr. Aishwarya. Thank you for such how beautifully you have explained to us, to our audience. Thank you. I'm sure everyone will get so much insight from this. So, Dr. Nirmal sir, I want to ask one question to you. So, how can one increase chances of a normal delivery?
Yeah. First of all, the way Madam has already described that what is the normal birth procedure, it is just a normal vaginal delivery we call it, and the chances to increase. See, all patients we divide the patients first of all into low risk patients and the high risk patients. Those who are a low risk patients, see, most of them, almost 70 to 80% patients doesn't have any other problems with that. So to increase the normal delivery, we just need to monitor the patient throughout the time. And when the patient enters, the way Madam told you, that 37 weeks, so after 37 weeks, patients can start doing their, as in they are doing the normal walks and everything. So they can do the normal walks and they can go for regular checkups to their obstetrician. Along with that, they can do the sonographies and come to know about what is the baby weight and what is the presentation of the baby. That means how the baby is presented in the uterus. So all these things are there. Once the obstetrician assess and sees that all these things are in a place for they are favorable for the vaginal delivery, then we ask the patients to come for the frequent checkup. And then along with that, patient has to do squats. They can do the squats at home. They should be doing it only on their bed. Then they can do the good walks, so that it helps the head to get engaged into the pelvis. That's called as engagement of the head. So it just an early procedure. At around 37 weeks, most of the patients feel that the baby's head is trying to go down, which is called as lightening. So those are the signs where the chances of the normal delivery are good. Along with that, there is something called as Bishop score. So around and pelvimetry. So if I'm right, Madam, Aishwarya ma'am. So we do the assessments of the we do assessment around the 37 38 weeks of the birth canal, and decide about the how the normal delivery can happen. So all these things, all these parameters together can help us improve the chances of normal delivery. Usually patients go up to the 9 months completion, and then they once they start getting the pain, then they come back to us, and there are really good chances that they can deliver normally, unless there is some contraindications like the baby's presentation is a breech. Then only we tell them that yes, we need to do a c-section. Otherwise the chances are really good. Naturally, God and nature has given us a good power that that we can really all the patients can really deliver normally. I will
Yes,
quote from a sentence from our professor. All patients should be delivered normally unless and until proved otherwise on the imaging that the pelvimetry has some issue or pelvis had some issue. Every patient should has a chance to deliver normally.
Thank you, Dr. Nirmal. So, Dr. Aishwarya, I would like to ask you one more question.
Yeah.
What are the benefits of a normal delivery? Can you hear
Benefits,
me?
the mortality and the mortality and morbidity to mother is very less when it comes to normal delivery. That is, morbidity is the amount of complications post delivery or during delivery, or mortality is anything which is going to risk the life of the baby or the mother. So vaginal delivery is always preferred over cesarean section, because cesarean section is considered as one of a major surgery where many layers of the abdomen will be cut through, and she has to undergo, and post-operative complications are more with cesarean. Whereas vaginal birth, it is natural process in which her postpartum recovery is faster, and chances of any complications is very less. So that is, overall, to reduce the mortality and morbidity, the best option is to go for normal delivery.
Thank you, Dr. Aishwarya. So, do we need to take an epidural during normal delivery? Is it necessary? Sir, Nirmal sir.
Yes, considering the recent scenario, see, all patient doesn't need a epidural. It depends on the patient's pain bearing capacity. We have to do a pain assessment for the patient, and the way we have to, throughout the 9 months, the way we talk with them, the way we counsel them, that also matters a lot. Yes, epidural anesthesia is a boon for all patients nowadays. We should give the epidural. We should offer all of patients epidural anesthesia. It really helps them deliver smoothly. One of my patient recently delivered with epidural anesthesia, and throughout those 8-10 hours, she didn't realize a 1% of pain also. Yes, at last moment, obviously we have to reduce the epidural anesthesia when they are about to push the baby out. That time we reduce it, and that moment, I guess, for 1 minute or so, she feel a little bit of pain. And afterwards, and when she delivered, after that also, while doing a suturing of the episiotomy, what we call as a cut around, to help the baby deliver nicely without any trauma. So those sutures also were taken nicely. So throughout that epidural anesthesia is a boon, and I feel that all patients who are going for a normal delivery should be offered on a particular, I mean, obviously for after assessing and everything, we have to give them option. But yes, we should offer all of them the epidural anesthesia, and it really helps.
Thank you, Dr. Nirmal, Nitin Gujarati. So, we have some question from the audience. So, so Dr. Aishwarya, can a normal delivery happen after C-section? Is a normal delivery possible?
Yes, definitely. There's a term called VBAC, vaginal birth after cesarean section. But there are few criterias for a patient to go for VBAC, that is vaginal birth after cesarean section. Not everyone with the cesarean section can go for vaginal delivery. Few of the criterias to name is, she should have a single cesarean section, and this gap between the two pregnancies should be more than 18 months. Less than 18 months is little higher risk for to go for vaginal delivery. And the indication of first cesarean, what was the reason for first cesarean section? For example, first cesarean section, she was in labor, she was progressing well, suddenly fetal heartbeat fell down, or the baby passed meconium. If that is the condition, maybe second trial can be given for vaginal, because that is one of the assurance that her pelvis was good for normal delivery. Whereas for breech, for example, first child was breech delivery, and this time we can assess her pelvis. If the pelvis is good, then she can be offered for VBAC. And another condition, another thing is, for example, first cesarean was done for CPD. CPD is cephalopelvic disproportionate. That is when the pelvis of the women is not good. There are few criteria where when the women's height is too short stature, and there are different types of pelvises in women. The gynecoid, android, anthropoid. So each pelvis has a different outcome for delivery. So we have to history from the first delivery, what was the reason for cesarean section, and followed by that we have to decide whether she is an ideal candidate to go for VBAC. But VBAC always has its complications and risk, both mother and baby. That has to be explained to the couple, and the couple has to okay with that. Only then they should be offered with VBAC. And post VBAC, since the uterus will be sutured, there are chances of uterine gaping, rupture. It is better if they deliver in a higher center with all the facilities under very well monitoring. Then maybe nowadays actually VBAC has again come back. Many people are offering VBAC, and there are many patients who are going for VBAC, and success rate has actually improved. But the only thing is there is risk compared to previous vaginal delivery going for normal delivery than previous cesarean going for normal delivery.
Okay, thank you, Dr. Aishwarya. So one more question, Dr. Nirmal. Can one start day-to-day activities just after their birth, or just after a childbirth?
Yes, absolutely. Within 6 hours, they are up and within 4 hours, they are up and above, and they can start walking around. Next day, they can go home also. Nowadays, we are discharging patients in 24 to 48 hours. If the baby is fine, if the mother is fine, yes, they can go home and they can start doing their work. That is the biggest advantage of normal delivery. And I guess
Yes,
if we go back 30, 40 years back, before, I guess, before our parents and grandparents were there,
yes,
so all of us would realize that yes, they used to do the delivery within 6 hours. They used to go back to their work. Yeah, there were some traditional things were there. Yeah, 1.5 months they'll stay with their mom's place, and they will have all the extra food. Or I will suggest, nowadays I don't recommend anyone, but all fatty foods they used to have. But
And
yeah,
restricted
so
water.
yeah, yeah. And I guess that hot pan used to be kept below the cot, and they used to do that the heating even my father was a doctor, so we used to use those red lamps. They were from the physiotherapy department, to give them heat massage kind of a thing for those patients. So yes, definitely that's the biggest advantage of normal delivery. Next day the patient is up and above and they can go home.
okay, thank you, Dr. Nirmal. So, thank you, Dr. Aishwarya, and thank you, Dr. Gujarati, for joining us today. So, thanks a lot for joining us today. The tips have provided an extremely helpful, and I'm sure that all the moms and dads will find them useful too. With
Yeah,
that, we come to an
something
end to our live
that
session today.
to tell to the audience and as well to everyone. See, any day, yeah, as we spoke, normal delivery is one of the best way of delivery. I don't call
Yes,
it normal delivery. I would
yes,
call it as a vaginal birth, because
Absolutely.
any mode of delivery it is, I feel it is the same process a mother will go. Okay, I don't think so. Any mothers who have underwent cesarean section or who is going to undergo cesarean section should feel bad for not having a normal delivery. End of the day, the baby should be healthy, mother should be healthy.
Yes.
The maximum
yes,
trial what the doctor can give for vaginal delivery will be given. Not everything is in our hands, right?
Right.
So if there is
yes,
something not in our hands, they have to go for further. So never, discriminate mothers based on the type of
yes,
delivery.
yes,
Delivery is
definitely,
a
definitely.
mother is a mother. So I just want to tell, like, all mothers are great
All
mothers.
mothers are equal, though
Yes, yes.
cesarean and though vaginal birth mother.
Yes.
At the end of the day, mother and baby and the parent should be
Baby
happy, and
should
that's
be
what we need
healthy.
to.
So,
Whole
Yes.
thanks
life.
for us today, and we had. Can you hear me?
Yes,
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 yes.
yes.
And it's actually the picture. Okay. Thanks a lot for joining us today. The tips and tips you all have provided, it's extremely helpful to all the audience. I can say that, and it's all the moms and dads will find them useful. With that, we come to an end to our discussion today, to the live session. Thanks to our wonderful viewers who joined us today, and thank you, experts, for sharing so many helpful pointers with us. And do keep following us on BabyChakra and stay tuned for more helpful and parenting videos and tips. So thank you, Dr.
Thank
Aishwarya,
you,
and thank you,
Bonita, for
Dr.
hosting
Nirmal
us, and
Nitin
thank
Gujrati.
you, Dr. Nirmal sir, for being a
Yes,
part of it.
thank you. Thank
Thank you, man. Thank you for joining. Have a great day. All of
Thank
you
you.
have a great day.
Thank you. Thank you.
Have a
Thank you.
great day. Thank you.